Welcome back and many thanks for staying with us on the number one breakfast show in the country, Morning at NTV. Ladies and gentlemen, the coronavirus pandemic is still rearing its very ugly head unabated. We are talking about 84,116 cases of COVID-19 being registered within this jurisdiction of ours, and we are talking about 1,000 people being killed in the last 1 week or so. That's how callous the situation is within the Pearl of Africa. So a face mask shouldn't be a conversation that you could be having with your neighbor. No, it should be mandatory for yourself. Not from government, but for yourself, because you need to protect yourself, number one, and your loved ones within the house. So when you meet 5 people along the way, please wear that face mask. Don't leave it on your chin. That's the only way you can avoid the contraction and the spread of the same. 1,966 people have been lost here in Uganda. 3 million, yes, 980,000 plus people have actually succumbed on the whole global stage, meaning we are less than 20,000 deaths away from hitting the 4 million mark. In terms of the cases, we've registered over 184 million, yes, cases of COVID-19 on the whole global stage. I have the treasurer of the Uganda Nurses and Midwives Union, Sister Anne Birungi. She's here in the studio to talk about the plight of the nurses here in Uganda. On the international scene, the International Council of Nurses is already sounding the alarm, saying that many of the nurses are now vacating their posts because of the unfavorable working conditions. And they say by 2030 we shall have a shortfall of over 13 million nurses. So right now we need to increase the pay, improve their working conditions so that we retain them in their working positions. We also do know that 115,000 health and care workers have died as a result of COVID-19 in many of the countries on the whole global scale. 3,000 of them being nurses. Here in Uganda, 58 doctors and nurses have died in the last 15 months as a result of COVID-19. So let's talk about the plight of the nurses and the doctors all the same. Sister Anne Birungi, very good morning.
Good morning. How are you?
The statistics are scary on the global international scene. The International Council of Nurses really think that many of your nurses might vacate their posts because of the unfavorable working conditions, no access to personal protective equipment and so forth. Is that largely the same situation right here in Uganda? Paint for us a picture of the plight of our health workers in this country.
Oh, thank you. The viewers outside there, good morning. Once again, I'm called Virungi Annette. I'm a National Treasurer, Uganda Nurses and Midwives Union. I'm also a Secretary for Women National Organization of Trade Union. Today, we are really very much disappointed about PPEs. This is something we should have planned a long time ago. Because when you look at the PPEs, the personal protective equipment,
yes,
this is something very, very important.
Yes, yes.
Because I'm seeing a scenario where a nurse buys every day the PPE.
For
the
themselves?
Mask, yes, for themselves.
With no help from government?
For example, if they give you like a packet, it is not for you only. It's the same packet, you use it for also the patients.
Okay.
So what happens is that you can be going to work on the patient and you find that the patient has no mask. So you have to give that same mask. So the masks for nurses and the
are being shared with the
patients are being shared with the patients because the community do not have the PPEs. And also, when they get finished, it's not automatic that I will have to get the PPEs. So you find that the mask you have, at least they can be there like for 1 week, then the next week you have to buy for yourself. And sometimes when you don't have money, you have to put on the mask for the whole week. And yet it is a disposable. I'm supposed to put it on when I work on a patient, even if it is just one patient I should change. But now, today, I know many health workers use these masks for more than a day. So it's really very hard, but we have already lost nurses.
58 of those doctors and nurses have succumbed during this novel coronavirus pandemic. And we also do know that in the last 10 days, Sister Anne Birungi, over 1,000 people have actually succumbed to the novel coronavirus, including 10 doctors. When you hear such statistics, what comes to your mind?
I actually think of compensating the nurses because I know the nurses who have died, they are more than 50. there are more than 50 as I talk, because I have a list of 50 nurses who have died of coronavirus.
So meaning the statistics that we could be having as a country might not be compounding the actual plight of the doctors and nurses on the ground, because they are saying 58 doctors and nurses have died in the last 15 months. And you're saying only 58 nurses have died. So how many of the doctors have also succumbed? The number could be over 100.
The number could be over 100 or above. But no, it's not yet 100, because what I know, so far in our union statistics, we have around 50 nurses. And 50 nurses who have died, confirmed COVID-19, who have died of COVID-19. And those nurses, some of them have died very badly, because when we die, when a nurse dies, you find yourselves struggling. Like, for example, you are the ones, we start collecting money on WhatsApp. Even when the person is sick, they will call you. You have to start looking for the money. There is no transport to at least designated for the health workers, so that you can quickly transport them, because we do a lot of work. I think we should be a priority right now.
In other countries, we've seen money being put aside for risk allowance for the health and care workers who are actually grappling and treating COVID-19 patients. What is the story here in Uganda?
Here in Uganda, the nurses and doctors who are working directly in ICU, they are getting allowances. But these ones who are working like on assessment, the nurses who get who receive these patients, they are not given risk allowance. What they have done, they give only those who are directly working on COVID-19 patients, and they have left other nurses. For me, I think they should give cross. Everybody should, even if they don't give the same. Because when you're on the ward, you will find that you are working also on COVID-19 patients, but they are not yet
actually, it is the same risk, Sister Annette Birungi, because I'm thinking that doctor that you interact with, that nurse you interact with at the reception, that is the person who is at most risk, because you get to interact with this patient even before they get to test and to find out that they have COVID-19. So you're dealing with unsuspecting citizens that could be hosts of this COVID-19 disease. But then guess what? They are not getting risk allowance whatsoever.
They are not getting risk allowance, and those ones who have died, according to us, they are those who are they are not the ones who are working in ICU. Because in ICU they have all the equipment to protect them. These other ones, they do not have enough. So you find that everybody should actually have the PPE enough, and they should also have that risk allowance. And also, I've also been so much surprised about the delay of that allowance. At least it should not delay more than 5 days, because when you die, you will even die before you eat it. So one of these days, I was sharing with a nurse in Mulago, who told me that for them they can delay up to even 6 months.
Besides risk allowances, have any of the relatives of the deceased or members of the health fraternity who have succumbed to COVID-19 received any kind of compensation?
No. They have not received any kind of compensation, and we have been asking for those forms for Ministry of Labour. We want to register we want to fill the forms of those people who have died of COVID-19, so that they can be compensated. And there is no shortcut. The government has to compensate those families of the nurses who have died. I know they have died in a very bad shape because they were not having enough care. And this is what we have been telling government. Can you please work with Nurses Union? Because you see, for us, we are like actually NRM. We have structures like the way you see NRM. Every district, if I want any information, I call the chairperson of Uganda Nurses and Midwives Union. So I have the structures. We have the structures where we can reach everybody. And those 50 nurses, I'm telling you, I've already asked every chairperson, how many nurses are sick? How many nurses have succumbed to COVID-19 and they have died? And we have everything, and we know how much they are suffering without care.
Do you believe the mishaps we are seeing right now in our health system might prompt many of our health and care workers to actually vacate the profession and quit for something different?
What you're saying is true, because I want to tell you, when they wanted the nurses to care for the COVID-19 patients, it was voluntary, and they advertised, and of course the nurses joined. But today, the way how the nurses are seeing the fellow nurses dying, And also the allowance is coming very late. It is very difficult. I'm sure the nurses are going to start fearing. Though we were born really to care, and sometimes you feel that you should not leave a patient because our heart, we really have the love for you. But we need care as well.
Because you've intended to hold strikes, which you've postponed later on because you had the interests of the patient at heart. But for how long are you going to bend over moving forward? Because it seems like you've been taken for granted one too many times.
What you're saying, everybody is saying it. And even the nurses are really annoyed about nurses union negotiations all the time. But I want to tell the nurses outside there that at least the update information I have, today the circular about allowances is supposed to go to public service. And short of that, if the districts have not received that circular of lunch allowance, I think this time the strike will be, it will not be postponed again because the nurses are waiting. But we are promised, and we really think this time the government cannot lie to us. And last time I was talking, I think the last time Uganda Nurses and Midwives Union had a meeting with the Prime Minister, I talked about the government lying to the nurses.
This
and
is
the minister
really,
was very, very bitter.
mind-boggling.
He said, how are you saying that we can lie? The government cannot lie. And I want to withdraw that we are the government. We are not saying you are lying to us, but the promises should be fulfilled. Otherwise, we feel very much dissatisfied.
So what is the union doing to make sure that the nurses are the priority during this fight of the pandemic?
Okay, since when the COVID-19 came in place last year in March, we have tried to lobby and write proposals. At first, we got money and were distributing sanitizers and masks to the districts. We moved all over the country, and some of the districts, of course, did not get. And this time, we have also written proposals, and we have not been able to get the things for the nurses, but we have been able to get masks. We make masks ourselves in partnership with KRU. We are making masks for the patients this time, because we have also seen that even if we have not been able to get the money for the surgical masks, these cross masks can also help us, because when the patient is putting on a cross mask, the patient actually is protecting you from getting the COVID-19. So we think that we can also contribute to the community, and we have been distributing masks. Recently we were in Kasese, and we are also going to Busia, Buko, those border areas we are trying to distribute, because I know others are saying you are distributing masks. And of course, when we find other nurses without masks, we also give them the close masks. But that's not what we want. We want the community to come out and work with us and give us support so that we can reach everywhere and give these masks. We are ready to work. We are ready to work with government so that when, and there is also this thing that is really disappointing. When the government, when the stakeholders of health go into meetings, they don't actually involve us. So the updates about what they are planning for the nurses, we are not aware. And at the end of the day, you find that we are fighting when actually they are cooking for us. We need information flow. If they know there is something they are doing and it is real, then we need to know so that we are in touch.
Because you're also hearing about the lunch allowance circular taking center stage today through hearsay, and you're not sure. So meaning anything can happen during the course of the day, and it doesn't come through. But do you think?
But if it happens, that will be the end of negotiations by the way, because it is too much. We need that lunch because a nurse is hungry right now. First of all, the immunity. You have heard about, you know that COVID-19 actually, the virus is targeting the immunity of a person. And when you are not eating well, what do you expect?
Indeed.
The weakness.
Let's talk about
you come very, very weak.
Let's talk about the vaccination, Sister Annette Birungi, because according to the World Health Organization, they've been calling on respective governments to ensure that they inoculate, first of all the health and care workers in the respective countries. Largely here in Uganda, have all the nurses and doctors been vaccinated against this disease? And how slow or fast is this exercise?
Yes, you see, the health workers are also human beings. Some of them have not gone for this vaccination because of the community, the WhatsApp and what. people are talking bad about the vaccination. But most nurses, the majority, have gone for this vaccination because they know even if you don't go for it, actually the disease will get you. So it's better even you go and vaccinate. So most nurses have been very cooperative and they have had the vaccine, and they're also happy about it because that is something that work on you psychologically, that after all the government has also worked on and very hard, and I'm vaccinated, my immunity is strong. But some of them have not, and this also gives me an opportunity to talk to the community about, because why should you just follow what is on WhatsApp every day? Because the health workers are everywhere. You can still reach the health worker to ask about whether this information which is on WhatsApp is really true.
I hear you loud and clear, Sister Annie Birungi. But then it's one thing to get the information on WhatsApp, and it's another to go to a health expert wanting to prove or ascertain whether or not that maybe article that I read on WhatsApp is true. But then this health worker also tells you, I'm also not going for the jab. Meaning even the people who are supposed to help us disseminate information to rally on the people to take on the jabs, who are also skeptical about the effectiveness of the vaccine, the health workers themselves.
The health workers themselves.
Since March.
Let me tell you, I have realized that the community also put on our foot and they start talking about things that are not true. One time I saw a WhatsApp where
talk about health workers who actually believe that this vaccine is actually going to do more harm than good.
No, they are not there actually. Let me tell you, there is a nurse there is a person who was on WhatsApp. I was going to give you a scenario.
Yes.
And was busy saying, for me, I'm from a hospital, I'm from Mulago, they have told us to kill all the people who come to the hospital. You heard about that WhatsApp? So that person, I don't believe that was a nurse. And it was an interview. Are you sure? Yes. Everybody who comes, we are supposed to kill. So these are some of the things.
Misinformation.
The person can say that the vaccine, I've been told by a nurse or a doctor that it's not good and they are also not having it, when actually it's not true. And I'm telling you, if we continue with this information, if you hear a person going on TV and talking about, for example, do not continue taking antibiotics all the time, it will lower your immunity. And you go home and take antibiotics for 20 days.
You're finished.
You are finished. And I want to tell you, if you continue not talking to the health workers, it is a very big problem. Because right now, let's
divulge that information, Sister Anne Birungi, right now on air. Let's tell them how effective this vaccine is.
This vaccine, it is effective. I have to say this because most of my friends who have had the jab, at least they have not been very, very sick. They can get sick, but you find them they're at least strong. There are very few people who have gone to ICU unless you have other underlying conditions. You see someone can be having diabetes, hypertension. The person is already on drugs.
So even when they take the jab,
it
won't be so much effective because they already had underlying comorbidities.
The system is already spoiled.
So it has nothing to do with, okay, this everybody person got the jab and then they got infected later on. No, you already had existing ailments.
Yes, problems. And I don't think really, you see when this vaccine came, the government was very clear. Do you think it wanted to kill all the health workers in the country when we are the backbone of the... So I believe the vaccine is working, and I'm telling everybody, I'm really requesting that we go for this jab. But one thing that I condemn about is this information which the community concoct and say that health workers have told me this. I know it is very difficult today because I have also been nursing a child of COVID-19. And you find that they test using these RDT, and sometimes the person can be negative when actually the person is positive. But it's not that all of them will be negative when they are positive. If there are like 7 people, maybe the strip can give negative results of like 2 people. But we have been telling the people, we nurses, that if you have the money, do the PCR, the one that tests the antigen, because that one is confirmatory and you will know yourself. The only problem which we have also seen that is very difficult, the people themselves are coming back and asking us that, please, how come that after 14 days again, when I go to test, I have COVID-19 again. It is positive. And that one has also happened to my own family. When we tested, we isolated my son, and after isolating him, the test again was positive after 3 weeks. But we were wondering whether we should actually now bring that child again in that, because there is that stigma. You are like, the person, the results are still positive. But there is long COVID. But you will not know about that long COVID and positive results, and even when you're when you have spent all the 14 days on drugs and you have been discharged, you will not know about it until you ask a health worker. And you will continue feeling so sorry for yourself. You will isolate the person. But actually, when you ask us, I've been asking people, and the doctors tell you that after 14 days, and even the information is on WhatsApp, is on Google. After 14 days, the person actually is no longer very dangerous, transmitting the infection. So if you have a patient at home, please, it's important that you don't, you can isolate the person maybe for 3 weeks or 1 month. But if you see that you have tested positive after 1 month, still you have to interact with the person. And in Mulago and in other hospitals, they no longer actually test all the people who are going for discharge, because that COVID, you will still be positive. So there is a lot of information that we have to share. And
indeed, we should continue diverging that same information, especially to do with how transmissible this new variant of this COVID-19 pandemic really is. In the first wave, we were talking about one infected person infecting 21 to 39 people. Now we are talking about one person infecting 80 to 100 people. Over 80 to 100 people, one person. Let's talk about how dangerous this new variant of the COVID-19 disease really is.
I think for me, when you talk about how dangerous it is, I feel as if blood is just shivering. Because there are friends of mine who have put on masks, and they have always put on masks, but you find them succumbing with COVID-19. There are some people also, some nurses, who have been very careful. In fact, they don't even work in COVID-19 areas like in ICU and what, but they have also died of COVID-19. Because the person who has the virus, you cannot know the person. Your friend, like when I was coming, I found the guards outside there, they are seated together. It's very common, even us in the hospitals, we sit together. You can be together in a studio and you are all together, but the issue is the distance. 2 meters. If possible, you can even discuss with the person in 4 meters, because information is changing all the time. So for me, this COVID-19, it has made most of us get so much frustrated. But for us as frontliners, we are supposed, even if you are in that anxiety and stress, you are supposed to be strong.
But here is the mind-boggling issue, Sister Annette Birungi, the fact that even after government learned that this coronavirus pandemic is wreaking havoc on many of our people, especially the people who are in the health department, they are still giving it meager funding. Do you think there is ever a scenario that will ever prompt this government to give health workers a priority in this nation? Because the pandemic seems to not have, brought that desired effect.
I like the way you are analyzing issues, because I have also been wondering. Last time when this COVID-19 came, the first wave, the health workers were very much worried, but the community came also and gave some donations. In fact, we had some rich man who even brought some buses, you remember?
I remember, yes.
For transport. We had some people who were giving food and other things, but today, I think the virus, people are saying, we don't know when it is going. Even when there is a lockdown, they are like, why should we be locked? We are going to be locked up to when? In hospitals, I don't see a very big change compared to the first time.
There were no lessons learned.
I think the money did not increase because the PPEs are still a problem. Transport for the nurses to go and work is still a problem, and there is work overload. The government has come out and said that they are going to add more health workers, and they gave a contract of only 1 year. So who is interested even to leave private and go to government, where the government itself is giving a contract for 1 year? We appreciate 776 nurses and midwives and health workers have they are advertising that they should come and join to help during this COVID-19. But why are you giving them only 1 year? You're just going to use us for only this 1 year, and then after that one contract, where am I going?
And where will they get the money to pay them?
It should be a motivation. Since this disease is already here, let us have the nurses and midwives and doctors employed. It's not, I'm not saying it's an opportunity, but let's have this kind of love, because we have very many nurses outside there. Every year, 5,000 nurses graduate, and they don't have jobs. And you come out and give us only 1 year, and we don't know the reason. Only 1 year, it's a contract. So I know people will come and apply for that job, but it's not a motivation. You should give us the jobs. If you have added 1,000 nurses and midwives, give us permanent and pensionable. But they have said only 1 year, and we don't know when the disease is going.
Indeed.
Yes.
We do not know when the disease is going, because cases are rising exponentially, Sister Annette Birungi, and we would like to know, especially the viewers who are watching the morning at NTV, do you have the capacity to handle the huge droves of individuals who are clamoring for your health services at the various health facilities? Under COVID-19, do you have the capacity to handle the droves of people who are now clamoring for health services?
No, we don't have, because we've been, actually, Ghana nurses and midwives have been talking about the structure. The structure of health, the system, the structure of health and the nursing structure. The nurses are very few compared to the patients. So it was last changed in 1995, and we've been talking to government that we need more health workers. And surprisingly enough, there is also they were moving in some districts, and they told us that I am aware that we have even received the information that we should reduce on even the nurses that you have, because when you see the staffing norm that they have now given the districts which had already employed more nurses, it is contrary. They are now wondering what to do. Are they going to chase them? I think we need more nurses and we need more doctors. The community need to be cared for. That one, they should plan and make sure health is a priority. They keep on saying that health is a priority, but today I'm seeing the community itself. Actually, this message goes to the RDCs. Why should the nurses be beaten when you are the representatives of the government?
No way, Sister Annette Birungi. Are you telling us live on Morning at NTV that the health workers are being beaten? They are being beaten. There are some police officers who are adamant. Actually, I've been investigating this morning. The nurse who was beaten, who is admitted in Kabale Hospital, it was the bodyguards of the RDC. So, together with police, they just met him. He was from work. He's called Muhammad. He's admitted right now. And they beat him. He was now coming from duty. And when we show our documents, sometimes they tell us that they are fake. They are forged. Can you imagine? That one I had it in Busia. Last week I was in Busia. They were saying that the documents are what? Are fake. And I want to tell the nurses, I think you need to join Uganda Nurses and Midwives Union so that we give you our IDs. Because these IDs, I've never seen a police officer asking me that, where are you coming from? As long as we show Uganda Nurses and Midwives Union, because we have already showed our name. But those ones who are saying that hospitals are issuing fake identity cards, I don't know which machine they use. Let's talk about
they are beating nurses, and it is very, very bad because you are demoralizing us.
Of course, let's talk about that militaristic approach in the implementation of the SOPs. Do you think it was ideal to use these military tactics to implement SOPs, or should we have used health workers like yourself, Sister Annette Birungi? Because I do know one thing, you cannot achieve behavioral change by forcing people, by beating them into submission. That can't happen. They would rather become unruly. It's like a child. When you beat them, they do the opposite. But if you talk to them in a very pampering way, they'll understand that, okay, mother or father is trying to send a message. Do you think health workers would have been the ideal people to interact with your governments when it comes to expediting behavioral change?
I think it is true that they should have used health workers. Because for me, when I meet a person, I've been working for 15 years as a nurse. But when I meet a person, I don't judge that person by the way they look like. Before they even talk, we think an extra mile, because that is our area. We have studied human being.
You look through the person.
So I look through the person. I can even know who is lying and who is not lying, because you have always seen a person comes in the hospital crying, but when you say, I will not work on you if you don't keep quiet, you see the person keeping quiet, and yet the person was exaggerating pain. So we have the experience to interact with